And we are live. Hello, gorgeous Elise Dallas. How are you? Are you well?
Very well,
Are
thank you.
excellent.
Yes.
A GP with a special interest in menopause, women's health, and you see a huge number of women coming to you going, I don't feel the way I really should as we enter midlife. What are the common things that you're finding that they're coming in with? And from a dietary point of view or from a supplement point of view, what could help?
Great question, because this is often where people in their mid-40s or early 50s, they reach midlife. Thank you for having me on again, Fiona, because this is honestly one of the number one questions I get asked is, what supplement can I take or whether they're worth buying? And they're very expensive. So I think this is a really great talk to go through about what might be useful. So essentially, someone will often come to me, they've heard about menopause, their periods might be irregular or not irregular, but they will often come to me with some symptoms, often vague symptoms, fatigue, slowness of the brain, brain fog. They may have the vasomotor symptoms. They might have other aches in the joints and the pains, palpitations. As you know, there's a myriad of symptoms which someone can present in because estrogen receptors are in every part of our body. And so what I will do when I see someone like this is not just assume it's menopause. We wouldn't diagnose menopause on bloods, but I will do other bloods to see if there are certain deficiencies that cause these symptoms that often crop up in midlife. So thyroid, vitamin D deficiency, the anemias, because often in perimenopause we get heavy, closer together periods. So you might see your iron dropping and causing anemia. And this is I did mention it before, but if you are going to have that blood test, please ask for ferritin. And although it might be reported as normal when it comes back as 20, anything below 60 or 70 is low in a woman, and so therefore needs topping up with iron. And so that particular supplement, as it were, would be over-the-counter iron, increasing in your diet. Often your iron stores will be restored within a couple of weeks, but it takes 3 months for all of your stores to be, you might start feeling better within 2 weeks, but you need to continue taking it for 3 months. And the advice is to take it with vitamin C, because that's absorbed better, because iron isn't absorbed well in the gut, and alternative days, because the gut doesn't really like iron as a supplement. So that's one supplement. Sorry, yeah, go on.
As we all know, I've dubbed last year the year of bleeding endlessly, and and got to the end of it and basically said, was found that, walking up one flight of stairs was making my legs tired, despite the fact that I do actually exercise relatively regularly, and have started taking iron tablets. But how do people know whether or not they do actually have an iron deficiency? Is it the hair loss? Is it the feeling tired? Is it the aching muscles? How would you know?
Feeling tired is the biggest one, because it's part of the hemoglobin, which is part of your red blood cell that carry oxygen around the body. So if that's falling down, you may not even have anemia. You might your iron starts to drop because you're bleeding. You haven't turned the tap off, so essentially you're losing all this iron, which goes into making these nice bright red blood cells, and you're not taking enough oxygen around the body. So tiredness was one, real fatigue. Hair thinning, again, a common hormonal reason, but hair thinning, and a common thyroid reason. But hair thinning, again, can be due to iron deficiency. Dry skin, and what was the other? I think you just mentioned something. I think that was it. But they're the two. Yeah, just feeling like, because I was iron deficient this year as well, much the same as you, similar reason, perimenopause, and heavy periods, and I was just exhausted. Like you say, your legs feel heavy, everything feels exhausting. Now, when you replace
it doesn't matter where if I'm at home, it's a dog. If I'm here in the ESK office, it's the non-stop sirens.
Don't worry. I live in Peckham, so it's we get the sirens as well, so don't you worry. But yes, so that's one very simple, as it were, deficiency that you can easily measure for in the blood. And and then clearly say, okay, I might, you know, and remember, vegans and vegetarians may have reduction anyway because they're taking in less, and you may have tummy issues, which may mean you absorb less. So there are lots of reasons why you might have this anemia, but that's typical. And so therefore that would clearly be a reason to supplement. To get you've got a deficiency, you either get it from your diet. I'm always, in terms of supplementation, we always want diet first, but clearly that's you're going to have to eat a lot of spinach and sort of red steak to get to those levels. So a supplement would be useful in this situation.
I have a number of questions here for you that have just come in on that as well. I've got about 3 questions here.
Okay.
One is, which iron tablet's the best? Now, I actually learned a very interesting thing here. Instead of buying the stuff off the shelf, I actually went to the pharmacist and I said, what would you recommend? And he went out the back and he gave me a thing. I think it was called Ferrograd or something like that. It was £4.95 instead of like 20 quid for the one off the shelf.
Yeah.
And I thought, well, good on him. But what would you normally recommend? And the other question out that came with that was, would you use it in a multivitamin? And would this type of iron deficiency make you feel like it's hard to wake up in the morning? They're the 3 questions that came to you on that.
What was the waking up in the morning?
Would an iron deficiency make it hard for you to wake up in the morning? Would you feel like that? Yeah.
Yeah, exactly. So yes to that question. The iron supplement, so the one you sort of get from your NHS, to be honest, something like Floridix, where it's a syrup, that often is much better absorbed, but everyone is very different because it irritates the gut. Some people have remember, everyone is different. That's the issue. For me, I get constipation. You know, in some people, it makes them have the runs. In some people, it's not very well absorbed at all because they're naturally IBS and they're going to the loo all the time. So essentially, you have to find one that suits you. It makes your poo dark or black, so you've got to be warned of that. But basically, some of them, the one that I ended up getting actually had vitamin C within it. So usually I would be advising, take it along with a glass of orange juice or some vitamin C. But actually a lot of them you'll see include, with vitamin C. So that aids the transport. So that's one vitamin that is very, very common that I see is deficient and it's easily replaced. The other vitamins that we measure for when we look for anemia is B12 and folate. And so again, vitamin B complex or the B vitamins, usually they are not low. And again, and unless you are vegan or vegetarian, B12 only comes from animal sources. So if you are vegan or vegetarian, because it's still in animal products like dairy, but if you are not eating much of those, then you do need a B12 supplement.
And is it best to have a B12 supplement that is sort of sublingually absorbed, or does it not really matter? And what if you drink a lot of alcohol?
It often is an injection. Because if you really are deficient, you're not getting any animal food sources at all, then an injection is best, and you'll have to have them every 3 months. But I have seen, if you're taking a maintenance dose, I have seen people topped up. Often we will do the B12 and it will be in the thousands. That doesn't bother us as long as it's above 600 or 800. I will know that they're taking a multivitamin because it's in there. And just going back to that previous question that you said about iron, no, there is not iron in a multivitamin. If you actually look at multivitamins, because iron can be toxic if you take too much, that will not be part of your multivitamin. It might be in a very small amount, but they don't put it in anymore. So that is something that you have to take as a single supplement.
You should be looking for, how do you know how much to take? I mean, I haven't gone and had my blood levels done because basically there is no point with my GP. So I've just taken what the pharmacist gave me. So, I mean, is there a minimum or maximum amount that you should be looking at if you go in there and think I might be iron deficient?
If it's iron, you should be taking the maximum dose that it says on that, because each one's compounded with a different substrate. So, it could be ferrous fumarate, ferrous gluconate. Take the maximum dose. So it's often just one tablet, but it could be 3 times a day that you've been prescribed by your doctor, but take them on alternate days. So it gives your gut a rest day in between. This was a top tip from a gastroenterologist, and with vitamin C. So that's it. And then you would just at least 3 months, if not longer. And then obviously address why you were deficient in the first place. Heavy periods, get a Mirena, or reduce the flow. So going back to the B vitamins, again, B vitamins are really useful in perimenopause, because now we're just going to talk about other vitamins and all of the supplements I recommend. I think it's really important to remember what a supplement is. A supplement is topping up what you cannot get in your diet. And so always diet is better, because vitamins come wrapped up in great polyphenols, or what we used to call antioxidants. They come wrapped in fiber, in the skins of apples. That's how they come. They come with the other goodies and the other benefits that you get. So always look at your diet if you are deficient, and take a supplement when either you're not going to get enough because you're vegan or you're vegetarian, you're not going to be able to get access to it, or it's just not available in your diet, like vitamin D. So let me just finish off with the B vitamins. The B vitamins, I would often take a complex, unless you are vegan, where I would take a vitamin B12 and ensure that those levels are fine. And you can check. We would only check B12 in the blood test, though. We wouldn't really check for others, because they're water soluble. You can't really overdose on them. What that means is, if it's fat soluble, you can store and get toxicity. If it's water soluble, you pee everything out. So all you will be doing is peeing excess out. It's the same as vitamin C. I don't take one of these vitamin C tablets when I have a cold flu. You pee it out. To be honest, it's a bit of a waste of money. These big fizzy ones with vitamin C, I quarter it maybe. That's enough. But if you're having an orange, a broccoli, all of these other food sources, that is enough. You cannot store vitamin C, and you cannot store vitamin B. So if you've got particularly poor nails, like I have, you might want to take a vitamin B complex with biotin, because it helps with the sort of hair and the nails. So then going on to another vitamin, which we see very low and causing tiredness.
I need to take you back again. One more question about the vitamin D here, and just before we get to I noticed actually, since I've been taking iron, my fingernails and nails are growing like no tomorrow. They are literally, I can't say they're actually any stronger, but they're growing like crazy. Now, there was a question here: how does buying iron over the counter compare to ferrous fumarate, or fumarate, as you mentioned?
If you look at the ingredients, they're just bound with different things, so they are exactly the same. It'll just be the dosage that they're different. So you just got to make sure you look at something called the RDA, the recommended daily allowance, and see what the maximum dose is. The one that you usually get from the pharmacy, from the doctors, they will say take 3 times a day, because you are in a deficiency. So you'll be taking, but if you are in a deficiency, so this is someone that has been shown to have iron deficiency, be taking the maximum dose for at least 3 months. And they will often say 3 times a day, but I can't give an amount, because everything is different concentration, and it depends whether you're treating a deficiency or a maintenance. But you can't go wrong with taking 3 times a day for 3 months. That would just increase if you're indeficient. And so that moves me on to another vitamin. So I'm going to sort of start with the vitamins, then go through the minerals, then maybe go on to the fatty oils, the proteins, and the fiber. That's kind of how I'm thinking, how we'll go through this, about what we need to think about when we go through midlife and menopause. So then vitamin D is another one. Again, that's one we test for. So that is very good. It shows the levels in the blood, and we are deficient in this country. It is really important for midlife and menopausal women to be considering a vitamin D supplement. We all know this from COVID, because we realized how it was linked with immunology as well, not just bone growth, which of course with osteoporosis, we need the vitamin D. So vitamin D, again, it depends whether you're deficient, which is when your doctor will probably put you on a huge amount. It sounds huge, like 20,000 units, 3 times a week for 6 weeks or something, but it's a loading dose, because you are in a deficient category. If you're in insufficient, like myself, I mean, I'm fair skinned. I should be getting enough vitamin D, but I don't. I sit and I work in a basement all day, and I'm always deficient. Plus the fact I probably don't absorb that much. So I now take as maintenance at least 2,000 units. The recommendation is 800 to 1,000. But to be honest, since COVID, lots of people, lots of my colleagues, we realized how good it was for immune function. And people were taking up to sort of 3,000 to 4,000 units, and they weren't having toxicity. I just spoke to a rheumatologist just before, who is, in terms of osteoporosis and things like that. And she's never seen an overdose when you're taking 3,000 to 4,000 units a day. So if, and plus people, forget it occasionally, but definitely throughout the winter, because you cannot get it from food. You can only get about 10% from food. So I would recommend it. That's one.
How do you know? I've got a lot of questions here for you. You've got questions coming at you. This is going to be like a squash match shortly. You're going to be having.
I know. Well, I think it's quite a big topic. That's why I was like, we'll go through each one, and I'm sure there'll be questions around that particular supplement.
This is actually just breaking away from the vitamin D for a section, but very good question here about would it not be sensible to recommend routine blood tests for women aged 40 and above when they've got these possible symptoms that sort of mimic menopause symptoms, so they know that they should be having a dietary approach to some of their symptoms? Would that be a sensible thing?
Yes, that would be a sensible thing. That's exactly what I do at my clinic. Unfortunately, mine is a private clinic, but saying that, if you look at my Instagram, you can get all of this done in your NHS. So the NHS will invite you from the age of 40 to have
This is where I laugh. I'm nearly 60.
I know we have this, but they do. They write it for 40, and they test for diabetes, and they test for cholesterol, and that's your kind of overall heart health. However, if you go in there with symptoms, that this is what they will look for. But no, they're not going to routinely check every single person for vitamin D without symptoms. There's just not the capacity. So therefore, you have to be your own advocate. But the NHS, these aren't fancy blood tests that I'm recommending. These are ones that you can either pay privately to get it quicker and more succinctly, or the NHS, where you can.
How do you know if you are vitamin D deficient then? Is it because you mentioned their rheumatologist saying whatever? Is aching joints a symptom?
So no, joints are not a symptom. Vitamin D is actually because it affects the bones, someone will often come in and saying, oh, I've got all over body pain. They've got this kind of all over body ache and lethargy. That we've found out that also having low vitamin D also it doesn't compromise your immune system, but it helps with immunity. It's a really important factor. So you might be just feeling really run down. Plus, look at your risk factors. We get it from the sun. We get 90% from the sun. Are you dark skinned? Do you wear a scarf? Or are you like me, fair as anything, no scarf, but sit in a basement half your life, working with no access to sun? You need 20 minutes of, I put factor 50 on. I don't go in the sun, even if it was available. So for me, I have to protect my skin. And so that's why I'm probably always deficient. When we were pregnant, which, women have just sort of, when they're going into midlife, and if they've chosen to have their family, they've often had all these bloods or, prenatal vitamins. So vitamin D was one of them, the folate. So that's when they might have considered it last, thinking, okay, I've got to take it for my baby. But then they forget, and then they forget that every winter they need to be taking it. If you're in the sun, you do not need to be taking it. You're getting. So was there another question on that, or shall I move on to another vitamin?
Hang on. Yes, it is. Wait on one.
So yeah, generally all that over body pain, aching, again, tiredness, but it's more the body pain. It's this deep bone pain.
There's a question. My guess is that this relates to the B group in the vitamins, but a question here from Julie asking, supplements always make me feel sick. I don't seem to agree. They don't seem to agree with me. Maybe I don't need them. My diet is very good. Or do I just need a better quality? Is it the B group? Because I often find B group make people feel sick.
No. So supplements make me feel sick. If I haven't an empty stomach, I vomit. I can't stand them. So this is why I would recommend first of all, the question you need to ask, do you need a supplement? Go to your doctor, talk to someone who knows about midlife health, about whether you require it. There are only certain things that we will test for. We will not test for an entire vitamin B complex to see if you're deficient. And like I said, it's water soluble. I'll test it one day and it'll be high, and then it'll be low if you've not had anything with that. If you think you're deficient in that particular category, there are lots of, the cereals, all of these breads, things like that are fortified with B vitamins. So maybe that would be a better way of ingesting your vitamin B vitamins. I don't know if this woman is vegan, but if she's vegan, then she does need to look into vitamin B12, and you can have it as an injection. So again, your arm's a bit sore, but that's every 3 months you can have an injection. So no, don't take a supplement instead of food. This is exactly the reason why you should always be food first, because it's done, yeah. And then if you were looking at the quality of the no, it's got nothing to do with the nausea. It's got nothing to do with the supplement quality, most likely. Yeah.
All right. Lana is saying she had a level of 60 for vitamin D and was told that this was normal. What level is right for us?
It depends which lab. So if they've said it normal, so they have a level, yes. So our lab says 50, anything above 50 is normal. So it depends what lab it is. And then my last practice, it was 80. So it slightly depends, but they will have a category of where they say deficient, so you're really low and you need these high dose vitamin D. Then insufficient, which is the one I'm always in. It's all right, nothing's gonna happen. But then the NHS won't supply anything for you. They'll say go and get an over-the-counter supplement. But we know the risk of not having sun for the whole of winter is a risk. So why wait when that's when your immune system's going to really need it with all the colds? Why wait? Just take a vitamin D supplement pretty much from September all the way around to, April. I take it all year round, really.
Will any old vitamin D supplements do, or are sprays better than tablets?
Sprays are better absorption, but tablets are fine as well. It's all to do, again, with the bioavailability and what your body does to break it down. But yeah, sprays are fine. Sprays are really good as well. But you won't get that from the NHS either. But yes, you can get loads of good sprays. I do that with my children.
Is there any particular time of day that you should take certain supplements?
Not really. Sorry, I can just hear my child outside, so I'm hoping he's not about to burst in. Is there any time to take supplements? No, not really. It depends. I can't do it on an empty stomach, so I do intermittent fasting. So I will take my supplements just before I go to bed, purely out of habit. That's it.
Okie dokie.
You've got to make sure it doesn't, like, for example, if you're on thyroxine, or, you've got to make sure it doesn't interact with your medication that you're on. Okay.
That was it. The next question here is, are there any contraindications for vitamin B12 injections?
Are there any? I don't know, to be honest, but I've not come across one. But no, I doubt it. No, I don't think so.
Right, I think we're out of questions for the moment. Move on.
Okay, let me see what the other vitamins. Okay, so then I'm just sort of talking about vitamins initially. So I think they're the main vitamins that I would consider. I would, just in terms of vitamins, always consider whether they're water soluble or fat soluble. Fat soluble ones you've got to be careful of toxicity. So vitamin A, for example, when someone takes cod liver oil or something, it's fat soluble. You don't want to, you need to be able to separate it out. But you'll be able to get these vitamins in a varied diet. So I wouldn't be thinking of supplementing with any of these other vitamins. To me personally, a multivitamin is a complete waste of money, because you've got to look at what you're deficient in first, or what you feel that you're deficient in, and then go and get that particular vitamin. A multivitamin, you're probably getting it in your diet anyway, if you eat a relatively varied diet. And so if we're going now on to calcium, so I'm going with calcium, magnesium. So with the vitamin D, this is good for bones, but we need the calcium as well. And so people need calcium much more. Our calcium need goes up in midlife and beyond, because our bones. Now, osteoporosis is a huge risk. We know that estrogen reduces it. So HRT, taking estrogen, is there for protective of bones and will reverse thin bones and improve bone strength. But we need the vitamin D and the calcium to lay that down. Now, calcium supplements, though, are another issue. We are recommended to take 1,200 grams of calcium a day. Yeah, milligrams, sorry, not grams. Milligrams. Now, therefore, if you're getting a lot from your diet, so you're having a diet full of dairy, tofu, whatever it might be where you're getting your calcium from, then you may not need a supplement. You won't need the whole 1,000, 1 gram. You will need maybe 600. However, it has been shown that there is a very small, I don't want everyone to stop their calcium supplements. This is not what I'm saying. But years ago, when we used to prescribe vitamin D, we used to prescribe it with calcium. I don't know if you ever looked in your granny's cupboard. She would have this, vitamin D linked with calcium. We don't do that anymore, because what it started showing is that if you're giving calcium, it can often lay down deposits in the arteries. And there was a tiny, tiny greater risk of cardiac events, so heart attacks and things. That does not mean taking a calcium supplement is going to suddenly give you a heart attack. What you've got to do is, again, look at your own personal history. Do you have any other risk factors for cardiac disease? And so what they looked, and so there's other ways of getting it. What they found was if you ate that much or even more in food, it didn't have this response. So you could eat as much dairy, so there's often breakfast cereal with added calcium, orange juice with added calcium, tofu with calcium, vegetables like soybeans, collard greens, turnip greens, chia seeds, bony fish, like the little ones with like the sardines with the bones.
Yeah.
High of calcium. Sesame, my boys know when they're eating their poppy and their sesame seeds. I was like, what are you getting here now? And they're like, calcium, good for your bones. So there are other ways of getting your calcium. And so what they found was vitamin K. So this is another vitamin K, but if you take a calcium supplement with vitamin K, that seems to negate that risk. So you can get supplements of calcium with that in. But I would be looking at your diet, because there are really easy ways of increasing that calcium in your diet, which is obviously, mixed with protein, mixed with other elements. You're not just purely looking for something just for calcium. So for example, milk or dairy products, they're going to give you the protein that you need as well. I'll come on to that later. So that's just something to think about.
If you're a vegan, again, if you're not into your dairy,
no, but there are soy milks with added calcium. If you look at all of these alternative milks, they've realized, how sometimes little that they offer. For example, almond milk, doesn't offer too much more. So you will see it'll say with added calcium. So I'd be looking at that. Then we go on to, any more questions about that?
Not at the moment.
Okay. And then there's a big one. I don't know it might not be big, but lots of people seem to go really wild about magnesium. I don't know. Yeah. So magnesium is another one. So I'm just going to take a sip.
It's interesting because while you're taking a sip, magnesium, they say for restless legs, they say for helping with sleep. What else?
It's a nutrient that needs to stay body. So it basically relates to nerve and muscle function. So that's why, and it's blood sugar levels. It helps with blood pressure. It helps in making protein, bone, and DNA. So what we're made of. But here's the thing: you are probably getting enough magnesium. So there is no point in getting, and it's very tightly controlled in your body. It's very tightly controlled by your kidneys and your organs. They're not going to, your body is not going to allow you to go, 0 point out of it. So you're not really going to go along and say, oh, could I have a magnesium? Oh, I'm really deficient. And that's not how you would pick it up. I would just ensure that you're taking enough of it in the diet. And so you could be taking things like pumpkin seeds, chia seeds. I love chia seeds. They've got so much in them. Honestly, go out and buy about. Everyone go out and buy a bag of chia seeds and add it to everything. They barely taste of anything. You know, I add a spoon on my yogurt, even if I'm having soup or a salad. I'll just add it because I know it's got a lot of goodness in it. But you know, almonds, spinach, cashews, peanuts, again, soy milk, black beans, edamame, peanut butter. But the supplements are overwhelmingly confusing, because when I first heard about it, I thought, oh, well, I'll go and get some magnesium. I've heard it's really good for muscles. You know, I'm starting to work out and muscle train. And, you know, my friend that runs a lot, she takes a magnesium supplement. And then I was just blown over. So magnesium can be bound with lots of different things. Magnesium citrate is the most bioavailable. It improves blood levels, because again, it depends on the bioavailability. So that means you might take it.
Because you sort of cut out there slightly. Which magnesium is that one?
Sorry. I'll go through a few and then I'll say what I actually recommend at the end. But it depends on the bioavailability. So you can take these supplements, but if it's bound and it won't be released and you absorb it, then there's no point in you taking it. So magnesium citrate is very bioavailable, but it's got a powerful laxative effect. Yeah. So we wouldn't be using that. And then magnesium oxide, remember, that's the one in the milk of magnesia, for example, and it's low bioavailable. You know, you could drink loads and loads of milk of magnesia. It doesn't mean your magnesium's going to go up. Yeah. It doesn't raise blood levels. Magnesium chloride, it can give you constipation. And it's an all-rounder, so it helps with heartburn as well, but it's not really going to raise blood levels. Again, you know, lactate, we add it to foods to neutralize. But malate is one, so you'll often find ones with little combinations. Malate is well absorbed. It's a bit gentler on the gut. Taurate promotes blood sugars and healthy blood pressure. And glycinate helps with inflammatory conditions such as heart disease and diabetes. Now, there is only one, so it's recommended in general that 320 milligrams between food and supplementation is of elemental magnesium a day. But remember, you're probably getting quite a lot of magnesium, and not many people are, well, you're a little bit magnesium deficient, but the reason I would take it is obviously that you are trying to improve something in your life, for example, sleep or mood. And what they've found is there's one called magnesium L-threonate. I should have got mine. Mine could be by my bed.
Really? Who needs many magnesium?
This is the one I take. This is very good because this is the only magnesium that crosses the blood-brain barrier. So what it does is it levels mood out and it helps with sleep. So I take it before bed. I don't always take it before bed, but that's what I take it for, as opposed to, gosh, I'm really deficient in magnesium.
So you said magnesium threonate, is that what you said?
L, so a capital L, threonate, Threonate, I think.
Okay. So many.
Yeah, so there's lots of different ones, but again, I would be looking at, if it's about muscles, then threonate can help, but that would be more glycinate, sulfate, taurate, malate, and you'll often find a magnesium complex, or they'll have a few, but they'll often not have the threonate. The L-threonate you have to often get separately, but that helps with mood. And they actually they did a couple of studies, and that actually improved depression and low mood more than a antidepressant in midlife women. So, so very interesting. The other, let me see. So after magnesium, now we're going to go on to essential fatty acids. So the big one that I recommend, and I have been taking it since I was prenatal and pregnant, I give it to my children, is omega-3. Now, omega-3 fatty acids, there is pretty much, it will benefit everyone, because it helps with heart health, it reduces autoimmune diseases, it reduces inflammation in the body. I don't know if you remember having a spoon of cod liver oil before you left the house. I certainly did. And
sorry, I have a
that's okay.
Sorry, somebody just trying to call me.
No, that's okay. So the key thing with an omega-3 though, so there's omega-6 that often, or there'll be omega-9 or something, all these complexes. I personally would ignore them. We don't want any more omega-6. Omega-6 are from, baked goods. In fact, we want the omega-3. And when you look at it, this is, we want to look at the content. So it's the DHA and the EPA. ALA is the vegetarian, which eventually converts into that sort of DHA, EPA. I don't want to confuse things. Basically, high DHA and EPA within it. So the cheap oils, because I did loads of research on this before I bought my particular one, often they'll have a very low content, like 30%. You want it in the sort of the 40, 50, 60%. And hot, that they're the letters that you should be looking out for. It improves brain function. It improves brain fog, cognitive impairment. My son has ADHD. ADHD features often have been the amount of women that are midlife that present as if they have ADHD. I know you've had someone talk on here about it, but omega-3 helps with that. It helps with skin, it helps with hair, it's protective of heart disease. I mean, it pretty much does everything, and I would recommend it to all midlife women. You can get it from fatty fish, but then you've got the mercury content sometimes be considering. So they don't really recommend more than 2 to 3 portions a week, and so therefore, I mean, if you look at Japan, they don't have an upper level of this. You can't almost overdose, and yet they're fine. So to me, a supplement thrown in on top of my food first as well. I still have lots of oily fish. And you can get vegans because the fish get it from the algae. It's just, and so you can go and get the algae version. You just need to make sure that they've got high content. So that's that one. Then if we look at protein, so I get a lot of people talking about protein.
Just before you move on from the omegas, are you also, what about omega-6 and omega-9?
No. Well, yes, they will often sell that, but what you really want is the high EPA, DHA in the omega-3. So if you've got then omega-6 and omega-9, which is packed full of, and basically bulking it up, you're going to have a lot less of that. That's the good stuff. Omega-6, no. That's not the one we really want. So it's... omega-6 is what vegetable oil, when you heat it up and you break it down into, it's an oil, but it's not a great oil for the brain or the heart at all. And then we go on to, was that enough? Yeah. And then we go on to protein. So I'm now going to talk about protein and creatinine. Now, protein is something I am getting my head around myself. I know I don't need eat enough protein. I am starting to, it's always been one of my New Year's resolutions, got to pack more protein into my diet. I find it really quite difficult. The general protein is essential for everything. It's a building block of life for muscles, skin, bones, brain, everything. We need hormones. We need protein, and we need more of it as we age. So because sarcopenia is where your muscle mass is, as well as your bone density decreases. It's a real thing, and obviously will plague us as we age. So we need to increase it. So how much do we need? I mean, it's found that pretty much the majority of women don't eat enough protein a day. It depends how much you train as well. Like, and when I say train, I'm talking weightlifting and exercise in general, or strength-based exercises. So I've been considering getting a protein supplement myself, purely for when I'm training, just to hit that protein target. So the general rule is about 1 gram of your lean body mass a day. So if my lean body mass was like, let's say 60 kilos, then I would need 60 grams a day. I personally intermittent fast, which means I only have a fasting window of 8 hours. And that's to give my gut a rest. And it's really good for reducing inflammation. When I talk about inflammation, I talk about chronic inflammation that's pretty much instigates all diseases later on down the line. So if you're trying to fit 60 grams of protein into pretty much 8 hours, it's quite hard to do if you're going to have toast or something for breakfast, or you break your fast with a soup that hasn't got very high protein. And so that's where I've had difficulty. I've bought high protein powders in the form of a broth, the soup with high protein powder, and add some chilies and stuff, and to get my protein high that way. And I'll sprinkle it onto other foods. There are whey proteins. So there's different types of proteins. There, in terms of when you exercise, it's been shown that the anabolic window, because protein is used for muscle repair and strengthening. And it's been shown that if you train, so it could be cardiovascular, but strength training, within that 60 minutes to have it a high protein meal or snack or drink or shake or whatever it might be, then that improves the repair and strengthens the muscle fibers for next time. So it increases your, so it helps. So if you were going to do it in the sort of training sense, which I've only just started doing, that would be the best time. I personally exercise when I fast. Some people don't agree with that, but I mean, obviously everyone's, and obviously I'm not a personal trainer, that it just suits my day better when I do that. But that means that, I might get hungry afterwards and eat more. So there, there's downsides to that. So some people train with a bit of protein before they train, and then train, and then do the protective or the repair protein afterwards. In terms of protein to eat, obviously still food sources are best, but you may need to look at supplements and to get that increase in protein in your diet, because I certainly am going to be looking into it, just because I just can't hit 60 grams of natural food sources a day.
Well, the difficulty is when you say, okay, a piece of cheese has got, say, X, if you have X amount of cheese, it's got X amount of protein. Is by the time you've done the maths to actually work out that you've got your 60 grams, you've got to almost be a NASA.
I think I think you've hit the nail on the head, Fiona, because that's the exact reason why I don't know what I'm eating and how much of I'm eating. So what I'm going to be doing, and this would be what any personal trainer or nutritionist says, is track first, see what you're having. There's loads of but not for calories, not for keto diets, but for nutrients. See what you're eating initially, and that's the hard work. That's the bit where you've got to actually, am I eating enough? I know I eat quite a varied diet, so I'm probably not too deficient. But if I had symptoms, I'd be thinking, okay, well, I need to either go and get my bloods done, which I did last week. And so I'm going to be doing a report on those kind of things and see if they've improved from last year when I was vitamin D deficient, iron deficient, high cholesterol. And so all of these things I had, and I'm seeing if there's an improvement this year. But I would say,
you won't leave me alone. It's the ESK people from Australia calling. So,
oh dear.
Yes.
You're going to have to wait. But yes, I would track first and see if you are lacking in any area. See if you can get it in food first, and then supplement if you need to.
Yeah.
Other big one, because it's muscle repair, and so when I looked into looking at the right protein powder. So whey protein, it's animal, so you can't have it if you're vegan, but it has all the essential amino acids. It's really easy to digest. It boosts energies and reduces stress levels. Then you can get the soy proteins. Apparently it reduces high cholesterol. I don't know. Egg protein, it's released more slowly than whey, so it helps say, that's the other great thing about protein, is it's you don't feel hungry. So that's the other good reason that if you're wanting to lose weight, increase your protein. Pea protein, really highly. So this is often, so I will hear people that have the whey protein, they get quite bloated. And so people will have pea protein, which again is okay if you're vegan, because it's really digestible, highly digestible. It's hypoallergenic and economical, and it's full of fiber. So that's another good alternative. And hemp protein, haven't tried that. It's again 100% plant-based. So you could try adding one of those if you do not feel that you're getting that adequately from a diet. But then there's a big one, and I don't know if people have heard of it, is creatinine. So why do we need it? It again is an amino acid, so it's a building block of protein. So that's why it's come under the sort of protein current, and it's stored in muscles. It's a naturally occurring compound. I'm just reading here, but what it does is it plays a role in producing energy during high intensity and short duration activities, such as weightlifting and sprinting. And so what people have found is that it's stored in muscle and it's used for quick bursts of energy. So therefore, people often take this as a supplement, and you only have to start small. But what it has shown, and I was doing a bit of research for this, is that it helps with age-related sarcopenia, so the thinning bones in the muscles. It helps making the most. So when you're in your workout, you have that little bit of extra energy. You can go a bit further. Your stamina is a bit more, and therefore, if your stamina is a bit more, you're building more muscle. And on top of all the protein that you're taking and the vitamin D and the calcium, you are building up that resistance in your bones and your muscles. The recommended is 3 to 5 grams a day. I mean, some people, obviously, if you're weightlifters, then you're much more extreme. You might go higher, but something just as small as that. It's very safe. It doesn't cause kidney damage. There has been a lot of complaints about things like bloating.
I've just got to hear Sue saying
or weight gain, but actually it's because it absorbs water and it causes bloating. But no,
they make your legs swell. So with that,
it's water retention. So therefore, I would probably start very small. If you were going to introduce that as a supplement, well, first of all, you need to put the hard work in. You can't expect to have creatinine and then do, sit on the sofa. So it is only beneficial. I know, I hope the same. It's only beneficial if you put the hard work in, because that's what it's working on. It's giving you that stamina. But yes, so if that person got swelling of the legs, I would start much smaller and be, it's very, very gradually increasing. You might not need that much. But you can't really get it from diet. So that's another supplement possibly you might want to, and always get monohydrate. I mean, mostly it's like that, but just get that. You don't need any of the other fancy stuff in it. Creatinine monohydrate. And the last, I mean, I've sort of mentioned collagen, but we kind of mentioned this before. Now, you and I have had a talk about this before. Collagen, again, is a protein. Sorry, I've got a frog in my throat.
That's all right. I think you're doing very well, considering how sick you are, and looking gorgeous and making.
Thank you. But collagen is one of those, again, very expensive supplements. And as we know, there have been studies on it improving bone and collagen, like in the muscles and bones. So that to take it for that reason is fine. It's, often what people will take it for a beauty reason, and that's fine as well. I got mine on, a Good Friday deal, like I said last time, and I've taken it for that reason. Has it made a difference? I don't know. I had when I talked about this last time, I had lots of people texting me saying it did work for me. And so I think it's finding a brand that is reputable, has a high dose, high bioavailability. See if you can find it on a sort of bargain or a trial. Try it for 3 months. As with any supplement, see how it does. It change your nails or your skin or whatever you want. I remember you didn't you have it, and you said it didn't really agree with you.
No, they didn't agree with me. I made the very lovely Anita from Totally Derma do a trial on it for me when she said, and I've got all these women who've got these fantastic results with their vaginal atrophy. And I was like, oh, come on, Anita. And so made us put the money where her mouth wasn't, and did exactly what I always say that people never take any notice of. But I did it for her. So I got 10 independent people, made them take it for 3 months, and 8 out of 10 or so of them did actually come back and say that they thought it made a difference to their hair or skin. So I can't afford to take it for 3 months, so I haven't. So I have taken it.
Essentially, so I've got H&M Brave. They did a Black Friday deal. I've been taking it, and it's very tasteless. I put it in my black coffee in the morning, and that's how I take it. So I think it's an expense that if you want to, you can. Other people say that if you're having enough protein, then that's also doing the same job. So it's up to you, I guess.
And the thing, I think this one, I think it's micronized to 40,000 Daltons or something. So it's absolutely tiny, because there are arguments there that, if you're absorbing, as I quote my friend, the Dr. Ginny, whose husband is trying to call me, if you can absorb a collagen molecule, there's something wrong with your gut, because it's huge. But also, a lot of these things have, so many, like the Totally Derma, has something, it's got 20 other different types of amino acids.
That's the other thing I was going to say. Exactly. So it's very difficult to do trials saying, okay, you're just going to take pure collagen and that's it. And you don't have the vitamin E and the retinol and all the other stuff that comes with it. And let's see what, look like. But that have been trials to show that there has been an improvement in bone and muscle. So it must get absorbed on some level. And so there's
lots of physiotherapy trials on joint pain and things like that.
Exactly. It improves. I took it initially for my plantar fasciitis. It didn't improve, but I don't think it was the collagen's fault. So, and then the last one we come to is not the last. Sorry, fiber. So fiber is another. It's not necessarily a supplement you have to take, but it's something to consider. Now, the reason to consider it's, again, family history as well. I have bowel cancer in my family, very strong history. So it's something I'm very, very conscious of increasing. We do not have enough fiber in our diets and the westernized diets in general. If you have, fiber does many, many things. It has insoluble fiber and soluble fiber, and it comes as one. You don't sort of buy one and the other, all carbohydrates, I guess, are packed up in fiber. So if you took an apple, for example, it's packed up in fiber. You take the fiber out, you just get left with an unhealthy apple juice. Yeah. So, which has just got high sugar. That's what we want. We want the fiber, the complex, because what it does, it does many things, but the main things it does is it attracts water, so it turns to gel during digestion. I don't know if you've ever looked at fiber gel or stirred it. It is literally like wallpaper paste. It will go like that and absorb all of this water. And the reason it does that is then it goes through the gut, and it is literally like a cleaner. It's a hoover. It's cleaning up your gut. It's picking up and it's making it move faster, so you don't sit there heavily constipated. Because that's the risk with any, developing any cancer. It's the slow transit, and lots of people have slow transit, which means it takes a couple of days to do a poo, because and a hard poo at that, because we're probably not hydrated enough, and our Western diet, we don't have enough fiber. Yeah, there we go. so it's soluble fiber is found in, it's oat bran, barley, nuts, seeds, peas, lentils, fruits, vegetables, all the things that I've been saying before that contain all the minerals and the vitamins and the calcium, the protein. It's often all combined. Now, when you might need, and also, sorry, what it does is it reduces the glucose and the insulin spike, so it helps with metabolism. It reduces triglycerides as part of your cholesterol. And it prevents overeating. If you've got a great big thing expanding in your stomach with fluid, you're not going to eat as much. So what I would look at again is see how much fiber you're eating. If you're going to have a bowl of yogurt with your chia seeds, add in lots of berries. They've got the antioxidants, they've got the vitamins, and then they've got the fiber. What you can do, and it's a really cheap way of doing it, and I've been doing it for years, is if you go to Holland & Barrett, there's something called wheat bran. It looks like a bag of sawdust. It tastes like a bag of sawdust. It's £1 or something. and you could just sprinkle 1 spoon. It doesn't, what the reason why it's quite tolerable, because lots of people can't tolerate that horrible mixture like fiber gel or psyllium husks, or, you know, when it's too difficult. But if you can't and you just want to sprinkle something on, sprinkle that, and that is a helpful bran. But
see, you get these diets now where people are basically saying to you, oh my God, you can't possibly have a bowl of porridge. A bowl of porridge is toxic. It's going to kill
porridge
you.
is different. It's slightly different.
No, but your fruit, because your fruit is full of sugar, and sort of, well, you're throwing away exactly what you said. I mean, it's full of fiber as well.
It's full of fiber. No, I would never be saying no sugar. No fruits. No, I would be always using anything with a dark color is high on my list, because it's got full of what we used to call antioxidants, what they now call polyphenols. Anything high in color, that could be berries, it could be different colored, you know, chard and kale, and all of these really, really, and you know, look how cruciferous they are, you know, the high fiber content. Brilliant for you. An avocado a day, for example, will not make you fat. It's a different type of fat. We've been told these things throughout like the 80s as calorie restrictions, but all of these fats are good. They will not, you know, they won't put weight on you. I wouldn't say just only eat pure sugary fruit. You've got to have, you know, it's well, you've got to have all the other things around it, like the calcium, the protein, everything else to go with it. But yeah, that's why, you know, I try to reduce juice in this house, because it's just the sugar and it's not good for you. So that increases obviously diabetes and things, and you want it to be pulling along through the gut, picking up everything as it goes along, making yourself feel full, controlling your you know, the insulin and the glucose spikes, and that's it. So that's essential. Oh no, sorry. Then probiotics. So probiotics, everyone is different, and I think this is the whole Zoe, you know, wave, is that they're doing studies on what people's probiotics are, and then, you know, the idea is to eventually sort of individualize probiotics. But essentially, probiotics are our good bacteria. If you are eating all of these varied things, you may not need an actual probiotic. I personally don't take a probiotic, but maybe I should, and I might look into it. If I'm unwell, if I've taken antibiotics, if I've had a spell of diarrhea, if I've, you know, if my immune system's been knocked, I will take a probiotic. You know, if you have thrush, all of these things, you might just want to rebalance. But essentially, taking I do fermented though every day. So I will have kefir or kombucha. My New Year's resolution is to start to make kimchi. So we'll see how far that goes. But essentially, I would be looking at increasing our fermented foods and getting the probiotics from that. If you are going to buy a supplement, though, I would be looking at a supplement that contains billions of probiotics as opposed to millions. I know it sounds loads. And looking at the strains, you know, the Streptomyces, the Lactobacillus, and wide variety of strains. And then you can buy them sort of freeze dried, or then you can buy them where you have to keep them in the fridge. So there's lots of different varieties, because they're live, aren't they? They're bacteria. So, and I know Tim Spector does a lot. I've been watching him on how to sort of make your kefir go further by pouring it into milk. I mean, I haven't tried it yet, but making my own hasn't happened yet. But yeah, to try and increase your probiotics, especially if your gut flora you think has been a little bit unbalanced, and you're not having a nice soft stool reasonably regularly. And the other one, oh yeah,
question. I was taking Optibac after my hysterectomy, and 3 months
taking
after
what, sorry?
Optibac, which is a like Simprove. It's one of the ones that the I think it's one of the ones that the dietitians generally recommend as a probiotic for things, and got awful GSM. Was this just a coincidence?
Oh, interesting.
Well, did they give you any estrogen after you had your hysterectomy, and did you have your ovaries removed? That would be my first question.
Well, yes, because GSM, as we know, is low estrogen, but then that provides an environment for then thrush and the flora and yeast to overtake. So whether she got GSM or whether she got thrush, I don't know. But that would, yeah, interesting. But maybe that's why we're trying to individualize our probiotics, because some people feel great after it, some people it gets some diarrhea, some people don't. So that's why I'm saying get a broad strength, like many varieties, and in the billions. But I personally don't take a probiotic unless I've been unwell.
There was a study that came out, I think today or yesterday actually, on probiotic pessaries, just going back to the GSM there, and whether or not they would or they wouldn't help with increased frequency of UTIs. And of course there were conflicting studies, and basically the upshot was more was needed, but it did think that perhaps they might be beneficial in some cases. So you kind of think in many ways, I can't see any mechanism by which GSM will get worse by taking a probiotic. But then again,
no, I can't either. Unless no, I can't, because but unless that probiotic didn't particularly have a lot of a certain probiotic that she particularly required for her vaginal flora. I don't know whether she got thrush in the end because of it. I don't know. But all I'm saying is it's an individual thing. If you're getting a range, if you're getting your fermented, and you're having a reasonably regular bowel motion, I don't think you need to then add in probiotics.
No, we are over time here on the Instagram. And I want to finish it because I don't want to lose it here on the Instagram. Just keep on going here, but I will end it here on the Instagram.
The last one I was literally going to say is turmeric or curcumin, however you say it. Just because I had an inflammatory response, I've been looking into this, and this seems to have, it's a really potent antioxidant, and it can neutralize free radicals. And I would be looking at one with a high, you can't get it from food, so don't go everyone sprinkling and blaming me for yellow spillages. You have to take it as a supplement. And so therefore I'm looking into that and taking it with black pepper or bioperine to help absorption. But that helps long-term inflammatory responses as well as possibly acute. So that's the only thing.
No amount of turmeric latte.
The other thing I was really quickly going to say is you really got to look into who's monitoring. These are food supplements. They are not monitored unless they have medicinal properties. And so you've really got to look into whether it comes from a reputable source or quality control, because you can be sold anything, and you've got to see who the suppliers are. So not just going on Amazon and buying the cheapest. Because it's third party.
You can look for, like, some of them have some sort of herbal approved thing, but I don't even know who moderates that. I'm going to end this one
because that's got medicinal properties, and so that's got to have a herbal. I can't remember the Herbal Institute, but they've got to have that tick. Well, they don't have to, but looking out for that particular thing. But yes, there are lots of regulatory agencies that are trying to monitor it. But yeah, essentially do your research and find a reputable source. And I cannot recommend one specific one, but go to a reputable brand or one that you find that your friend or colleague has recommended.
Brilliant. Where do people find you, my love, if they want to find you?
Dr. Elise Dallas on Instagram, and I work up in Harley Street at the London General Practice, where I do a whole midlife revamp, looking at not only your hormones but your whole midlife health and doing lifestyle.
All right, I will end this here. I've ended it on Instagram already. I will end this one here now. And thank you again. That was really good, actually. Loved it. Loved every minute of it. And I will speak to you soon.
Excellent. All right. Thanks so much, Fiona. You take care. Bye.
Bye.